And we are live.
Welcome to Mentor Spotlight series, a live conversation to explore the role of mentorship in developing the professional identity of physicians. I'm your host, Javier de la Maza. I'm a pediatric emergency doctor, and I'm the executive director of Ars Medica. And I'm really excited because tonight we have a very special guest, Dr. Theresa Miskimen. Dr. Miskimen is a clinical professor of psychiatry at Rutgers Robert Wood Johnson Medical School, and she's also medical director at the Department of Psychiatry at Hunterdon Medical Center. Over the years, Dr. Miskimen has integrated the delivery of psychiatric treatment with clinical research, addressing the influence of culture on symptom presentations. She's a devoted educator, a member of the American College of Psychiatrists, and a distinguished fellow of the American Psychiatric Association, where she served as the president of the New Jersey Psychiatric Association, and most recently as past speaker of the APA Assembly. Welcome, Theresa.
Hi, Javier. Thank you very much for having me tonight. I really am looking forward to our chat this evening.
No, we are honored to have you here. And I wanted to start out by asking you if you can tell us a little bit more about yourself and what inspired you to pursue a career in medicine.
So first of all, I'm from Puerto Rico. I speak Spanish, just like you. And one of the things that I think that inspired me most to follow in medicine is that from an early age, my parents, who are both college professors, really instilled in me a love for learning, a love for education. Of course, my mother, I think, is my lifelong mentor and role model. She absolutely was all the time letting us know, whatever you do, you have to do it with passion and make sure that you go through life with gusto. One of the things that I'm very proud of also, and that's something that I share also with my mentees, is that I come from a long line of very strong women. So generations of trailblazing women. I think that one thing that runs in my family is that women have been hardworking. They have educated themselves. They stood up for other women at times when it wasn't really that common. And that's something that really has been crucial to me. And why pursue medicine? I think that more than anything, science has always been part of our life. My parents, my father was an oncologist, my mom was a plant pathologist, the first plant pathologist in Puerto Rico, by the way. And this love of just being in science led me to go into biology. And within like 3 weeks into the comparative anatomy course, I knew it was like peak interest in medicine. So what I did then is that I basically went into a very convoluted journey. So once I got into medical school, I was convinced that I was going to be a surgeon. And for the longest time, I was just like, yep, I did my anatomy. I really like to do this. I went through the course. I did not faint the first day that I was in the anatomy course. And it really changed for me. Again, talking about that journey on how is it that you go from being in medicine and to finally deciding your path. And that had to do with my clinical years. As I went into my clinical practice, I was noticing that during rounds, I had to go back to that person and inquire more. So yes, they came in, they had hepatitis or appendectomies, but I was always more interested in how did this illness affect you? What brought you into the hospital now? How is it that this acute illness is affecting the way that you're reacting? Did it affect the way that you're living? And one thing led to the other. And my mentors at the time were saying, I think that you have a career in psychiatry. And that's basically it. So here I am.
You are.
Here I am.
Yeah, that's a wonderful path that you followed, and I'm sure all these women that inspired you, or that also open these opportunities before you and your family are very proud of you. I'm sure of that. So, in your opinion, what characteristics make up a good doctor?
With I think that the most important thing is empathy, followed very closely by you have to be compassionate, you have to be humble, and you have to be self-aware. Those are characteristics that are my mission statement. So part of what I request my mentees to do, and I've done it myself, is to create what your views are. What is it that will guide you through your work on a daily basis? And I have a gratitude journal, and these are the 4 things that I have written there. So again, it's empathy, compassion, humility, and self-awareness.
Yeah, that's beautiful. Where did you get the idea of the gratitude journal? That sounds like a wonderful tool, to guide your.
It's interesting that you talk about it. So about 4 or 5 years ago, the American Psychiatric Association convened a group of us, and we were keenly interested in what is it that we could do as an organization to help physicians, specifically, of course, psychiatrists, because we had seen this huge surge in burnout. So this is something that was definitely in the eyes of residency training, and somehow it had not percolated all the way up to attending to the physicians that were doing in and out work. And they had this big initiative, and as part of the initiative, we did a whole research about what can we do as an organization, what can we do as a profession to decrease burnout. And some of the things are surprisingly easy. And that is things like creating a gratitude journal, making sure that you know what are your guiding principles. What is it that motivates you? Why is it that you're waking up 5, 6 o'clock in the morning to do rounds? You're then seeing patients, then you have your pajama rounds to do your charts at night. There has to be more. This is not just work. This is your life. So that's where it started. So one thing led to the other, and I keep a gratitude journal.
Yeah, no, that really resonates with me and the work we're doing at Ars Medica. And I think a lot has to do with this idea of creating space, and that's what we are trying to do, create space for connection in medicine. That's what actually we have defined that as our mission. But medicine, it's a busy world. There's a lot to do, a lot to learn, and sometimes we forget that it's also important to create that space. So thank you for sharing that, and I hope that other colleagues that are listening to the interview can take and adopt this idea of the gratitude journal. I love that.
I gotta tell you, there's a plug also. I just realized if you go up on the website of the APA, there's Face Forward, and in terms of you can go in, you do not have to be a member. There's a lot of resources that we put together. Again, gratitude journal is just one of them, but you could do a lot to really take care of yourself and be able to do more and be the best doctor that you could be.
Yeah. So moving on, you already mentioned that your mother was your first mentor. right?
Yes.
But I was curious to maybe, hear more about her role and how she inspired you, and also what other mentors did you have at different stages of your professional journey?
Absolutely. It's interesting because I'm lucky enough that I still have my mother, and we talk every day. I'm in New Jersey and she's in Florida, so we talk every day. And that particular space, and you were talking about space, that is a space that has allowed me to talk unfettered. I go over ideas. She's very patient. I have to tell you, because it must be boring, but I do have that space, and I think it's so critical. And this is something that, just as she did this to me, I am trying to create the same space for my children, for my coworkers, for my mentors, and my mentees. So you're right, it is a community. One of the things that I did notice as I was, talking with you about this particular mentorship presentation, is that it has changed. Mentors do change. You evolve, and as you evolve, mentors do change over time. So in terms of what type of mentors have I had over the years, I've had many mentors, and they come, it's a very dynamic process, right? They come in and out of your life. Sometimes it's a mentor that I see for 6 months and I never see again. I've had mentors that have been with me, like my mom, forever. And it's just, that's the way that mentorship should work, because you're changing, your needs are changing. And there is no way that one person can be able to give you everything that you need to be safe in that space that is created. For instance, when I first started in medicine, because I was still starting, and when you start off any career, what do you want to do? You want to become an expert. So it's all about you. It's all about your knowledge. It's all about, how is it that I'm going to become that content expert person, so that when I see patients, I'm going to be able to provide them the best care. And my initial mentors, it was all about case discussion. So, which medication should I use? Should I hone in on this particular therapy skill? How do I increase adherence of the patient? What do I do? And by the time that you hit mid-career, you really start looking around, and the mentors change. I was looking at another type of mentor. So all through my mid-career, it was beyond me. It was what was happening away from my clinical practice. And I started looking a lot more about systems. So at that point in mid-career, it was not just that, what will be my next publication, me. It was more, how can I start improving the clinic practice management? Are there things that we can all work together? Is there a project that we could do? And now that I'm a little later in my career, I won't say how many years, but definitely later, it's a different process. Now it's all about, how is it that I'm going to help those that are coming behind me? It really has changed. You know how I know? Because, and I still have mentors, obviously. You will always have mentors. It's a lifelong process. But how do I know? How do I know it has changed? The conversations that I've had with my mentors recently have totally shifted. And they're shifting in a way that it's about, how can I expand that scope even further? How is it that I'm going to be networking with people that have the same type of ideas on how to elevate? How is it that we're going to be able to provide for the patients better outcomes, better way of life? And to me, that's critical and crucial, because I'm a psychiatrist and I have to see patients that have been diagnosed with mental disorder. that because there is still so much to improve and so much more to give to the profession, the patients that I'm seeing are dying 25 years younger than the general population, and that has to change. So again, it's the whole process started from me worried about how much knowledge I can attain, all the way to how can I improve, not because it's me, but as an organization, as a community, how is it that we can go the next step and improve that life in front of you?
Yeah.
So, yeah.
No, I love that process, how you describe the process, and it's wonderful, you know, to hear how it starts with, you know, getting to know yourself, you know, very well, and you know, and acquire the skills and the knowledge that you need. And once you reach that point where you feel you know, comfortable with that, you can then start to look at your surrounding and think of ways to change the environment. You know, are there any you know, particular mentors, you know, colleagues or people outside medicine that have been influential to you in the recent years and at this career stage?
Yeah, I'm glad that you asked, because I've had this conversation with some of my mentees. I think at the start of your career, you really are focusing on, I'm a physician, so all my mentors have to be physicians. And that is not the case. Non-physicians can be great mentors. Let me give you an example. So in addition to my mom, of course, I have two mentors that have been with me for many years. And again, I have had many mentors coming in and out of my life, but these two particular mentors have been with me for many years now. One is my husband, he's an engineer, and the other one is a retired executive. And he used to be my boss at one time in my life. And I think that having a non-physician as a mentor is critical. It is something that will expand your horizon. It will be an opportunity for you to bring in another point of view. It will bring in other ways in which you look at problems. In my specific case, again, my husband's an engineer, and my friend, he is more into the entrepreneurial, so he's more business. And I'm absolutely convinced that having those two perspectives has allowed me to look into what I've done to have additional skills. Budgets, for instance, before I started working in administration and mentoring with my friend who was an executive, I was like, budget, what is that? I was in an academic setting, right? So it's like, budget, no. But now, and especially at a time when you really need to make sure that you're utilizing resources, the fact that he actually took me to a step and saying, you really need to know more about how things work, the business part of it. So I think as a physician, had I not had that opportunity to be mentored by somebody who was not a physician, who had that other perspective, I would have missed a fantastic opportunity to actually be effective as an administrator as well. So absolutely, highly recommend it. Look for people that are not exactly like you. If you can do opposite from you, even better.
Yeah, and also be open to you know, learn things apart from medicine, because you know, it's a complex. The healthcare is very complex, and I think we need to be also looking for opportunities to you know, gain different knowledge to understand the system. So moving on, I was curious to hear about your role as a mentor. You know, I know that you have been involved in you know, the training of medical students, residents, fellows, And you have mentioned also that you have mentees, and could you, tell us a little bit more about that, and how do you approach that process?
Absolutely. It's something that I was not like really, okay, I'm going to be a mentor. Today, this is my to-do list includes, I want to be a mentor. It's something gradual. And I think that critical on how it happened was that as a physician, if you have the opportunity to teach, that would be a springboard into then mentoring. I think that people, there's differences. You can be an educator, you can be a role model, and you can be a mentor. It's different. There's a difference there in terms of the involvement. And mentorship is very involved. And you have to be very generous for you to accept that responsibility, because I see it as a responsibility. We're talking about, so what about, how do you see your role as a mentor? It's an incredible responsibility, because here is this person that's coming to you because they see something in you that they like, that they believe that is something, that whatever characteristic it is, that is something that I want. So now you're responsible to be able to communicate well with that person, to be able to mold some of the aspirations. What is it? What are the next step for that person? So responsibility and generosity, I think, have become critical to me. Again, it's different. So yes, I've been a teacher, I've been an educator, but it is definitely different with mentorship. And I've noticed that for women, it's a lot easier now to get a woman also who's a mentor. I remember when I first started, the majority of my mentors were men. And here I am, 30 years into this career. And I am so happy because I see how many more women are doing this. And I don't think it's because women were not generous. I think that the work-life balance interfered a lot with that. So part of what I see as my role as mentor is talk about that. How is it that, because my mentees will become mentors. So how can I ensure that that chain does not get broken? How is it that we're going to be able, specifically for women in medicine, how is it that we're going to be able to keep women at the table so we can continue bringing more women up with us? And that's what I really think is my role, to be able to not only be a mentor, but cultivate the same passion so that the next generation can have mentors as well.
Yeah, no, that's beautiful. In the same way that probably the women in medicine that came before you also did, in terms of laying out the groundwork, so people like you could step up to leadership role. Yeah, it's so important. So do you have any other thoughts on how mentorship has changed in medicine throughout the years?
Oh, absolutely. I have a lot of thoughts on that. And again, I think that one, more women are being mentors. And that is something that, especially the last 5 or 6 years, mentorship is not only about getting a research paper and getting a publication. That relationship is at the core. And people are now dedicating the time. And it is, at least in academic centers, it is something that is being brought in, even in a curriculum. So mentorship has been elevated. And it is not only expected, but I think that medicine has now realized that they really have to be able to allow for people to provide the time, because it is not only about educating. You really need to be able to come up with ideas on how to incorporate wellness, how to incorporate time management. These are things that 10 years ago, 15 years ago, we were not talking about. Now we really are talking about that. How is it that we're going to be able to be human, but also a physician with increasing demands of our time, with increasing responsibilities, and the amount of things that you have to do every day? Believe me, they don't come down. It's always like more and more. So part of allowing for that space to be sacred, that has changed.
Yeah, that's a big challenge there, to advocate so organizations also are open to provide that time, and the resources that requires. So looking back on yourself as a young physician, what are some of the things that you know now that you would have wanted to know at the beginning of your career?
For sure. This is something that I mean, I'm laughing because I just had this conversation not even 2 weeks ago. To be mindful and present. I really believe, as I look back and look at my career, I don't think I enjoyed the journey. There was this hectic energy, like busy energy, right at the beginning of my career. And it was all about the next promotion, the next paper, the next research, the next. And before I knew it, I'm not even mid-career anymore. And I finally got it. So I don't want for my mentees to have to wait until they reach my stage of the game to understand that the journey is the important piece. It's not the end of like that goal. At the end of the day, okay, so I have X publications, I've done this. Enjoy that journey. So that's what I wish my young person would have known, is like, be present, be mindful, and not only in your life, but also as you're seeing patients. That will not only create for you to be a better physician, but it will also create for you to enjoy what you're doing, in spite of all the annoyances that come in with the EMR, with all the things that are happening. The bottom line is be present, be mindful. I wish somebody would have told me that years before.
Yeah, that's such an important advice for all the colleagues that are, like me, for instance, we're early career physicians. So yeah, this has been a wonderful conversation. I really appreciate all the great advice and the stories you have shared with us. And it's been a pleasure, really. I hope we can continue this dialogue in the future. And for the audience that are out there looking at this streaming, I wanted to remind you that this event was brought to you by Ars Medica. We are a nonprofit organization dedicated to nurturing the personal and professional growth of medical students and physicians. Our online community brings together doctors, residents, and medical students to inspire and support each other in our journey towards a meaningful practice of medicine. If you want to join our community or learn more about our work, you can go to our website. That's ars-medica.org. And don't forget to subscribe to our YouTube channel. Until next time, and good night.
Thank you, Javier.